Welcome back, folks, to Free My Pain Now with Dr. Matt DiDuro. And I have a special guest today. It's Holly Hudak. And hi, Holly. Welcome on.
Hi, Dr. DiDuro. How are you?
Good. You sound so good and healthy. And we have to go back a couple months when we met, right?
Yes.
First off, your wonderful daughter found us from Switzerland. Is that correct?
She did. She did a lot of research for me, and she was convinced that my life was going to change for the better if I would only come to your clinic and meet you.
Why did she specifically find us out of all the doctors in the world? Why did she circle in on us?
Well, she's very good at research, and she was looking for some particular things, I think, in the stories surrounding the doctors and the places that she looked at. And so there must have been some very positive things that jumped out at her, because she's very, very serious about research and planning things, and that's kind of what she does for her business. And I can always count on her to help me if I need information and I need to make decisions.
Well, specifically, she found our low-intensity extracorporeal shockwave treatment. So that's what really pushed her towards us. And when I met you, you were in tough shape. You're early 60s, correct?
Yes.
And at the time, you were confined to one floor. You weren't able to walk up steps.
That's right. Not only could I not walk up steps, I couldn't walk up the hills and down the hills of Atlanta, which means not being able to leave the house at all, because I lived in downtown Atlanta, and there was nowhere that you could go where there wasn't a hill. So it was not only physically confining, but rather kind of mentally confining.
And do we know what triggered your injury? Was there a specific incident?
Well, I have not really an incident, but a history of a tear in the lining of my hips. And I also have some spinal degeneration between L4 and L5, like a lot of people my age. And so it's just it's a combination that throws off my gait, and it gets me out of alignment really quickly and creates, all different kinds of pain. And and there's for my age, there's no surgery for it, and I can't and won't take the pain-relieving medication. So
that was not going to fix your problem. That's right.
It was not.
And I remember when I interviewed you and your husband, John, and I found out we went through that Toronto clinical scoring test to find out if you'd be a candidate for this. And I went down and I laid it out for you. We only had 2 or 3 weeks with you. You were moving back to Chicago. Your husband's job had sent you guys back there. Plus, you had a family trip set up, and I remember I felt so terrible for you, and you were trying to decide. And I said to you, if not now, then when, Holly? Right?
That's right. You did say that, and I was just really amazed at how everybody on your team rallied to help me get back on my feet, starting with you. The shock wave treatments were exceptionally good. They categorically helped me in the short term, and I still find in the long term. And infrared treatment.
Yes, in short term, I will tell you, helps decrease inflammation, helps improve circulation. But you were coming in at the same time where we had some Olympic hopeful athletes, and you were getting treatments. Basically, you were being treated like an Olympic athlete. So we love that we can take care of, that average patient and give them world-class treatment. So
well, I felt very special, and I felt very well taken care of. You saw me on Saturdays. You squeezed me in during days when I knew you had no time. But you were really concerned and cared for my well-being and my health, essentially. And so in that short period of time, I went from being essentially immobile to getting back up on my feet. And
where are you
my
today? Tell us some stuff that you're doing. I know you were able to.
I'm
I couldn't
in
wait.
Chicago.
Yes, but you couldn't even walk up 2 steps when we worked. Now you're
I
doing
could
what?
not. Well, today I've already walked an hour, and I walk like that every day, and my activities are not limited. For me, even more difficult than walking has been sitting, and yet on Friday night we drove up to the Ravinia Park, which is 2 hours from downtown Chicago in rush hour traffic. Then I sat for 3 hours and we drove back. That would have been unthinkable.
And you survived, and you continue to heal. And really the true benefits, the long-term benefits, are now that your own stem cells have migrated to that area and you have your own natural healing really taking place, which is important. So, Holly, thank you so much. I know you've been on the phone today a couple different times, and I really appreciate
pleasure.
it. And
I've been telling everybody up here in Chicago that they have to go, if they have pain, they have to come down to Atlanta and see you, because, I really didn't believe it was possible for me to be pain-free. And I do have long periods of time now where I'm pain-free, and it's really just close to a miracle.
Well, hey, I love it, and I love that you're having this sustained benefits from this. So thank you so much, Holly. I look forward to seeing you next time you're in Atlanta.
Thank you. Yes.
All right.
Take care.
Bye-bye. So, that's just another satisfied
amazing
patient. And if you go to our freemypainnow.com website, you'll see hundreds, if not thousands, of other testimonials, real live patients, just like Holly. And Holly saw that, and she went through the videos, and she was like, wow, if he can help that person that's just like me, then maybe there's a chance. And, sometimes people just are at a point where they just can't see it. And I saw the potential in her, and I saw.
Well, what I want to say is a shout out to you, Dr. DiDuro, because even Holly called it. You showed up on Saturdays for her. You are always there for your patient. You put them first, and I look up to you as a doctor. I really do.
Thank you. That's important, and sometimes my family sacrifices a little bit, but, that's why I got into this. I want to help people. It helped me so much, and I just want to give back. So this might be a good time for us to go through from Dr. Bernstein's book, Diabetic Solutions. It's really foot care for diabetics. And it talks about really the top 20 tips to keeping your feet healthy as a diabetic. And with permission from them, I'm reviewing a couple of these. And I'm going to go through these top 20 so that we can have them. And we'll go over some other things in the next segment. But the following guidelines are important to follow. Number 1, never walk barefoot, indoor or outside if you're a diabetic, type 1 or type 2, right? Number 2, purchase new shoes late in the day when you've been on your feet for a while. They should fit comfortably from the first day. You're not going to grow into them. You're not going to break them in. Number 3, you should not wear narrow or pointed shoes. It's tough on your toes and your feet. Number 4, inspect the inside of your shoes daily. Look for any type of torn materials, damage to the insole, or nails protruding from the sole. Get them repaired. You don't always have to throw away your shoes. My father was a shoe repairman. Don't wear sandals with thongs between the toes. And try to alternate shoes throughout the day as well. One of the best advice I used to see my dad give his customers was change up your shoes 4 to 6 hours in. And I'm really against high heels too, by the way. I'm starting a whole movement against that. Inspect your feet daily for irritation, redness, cuts, or blisters, right? Be sure to check between the toes. Use mirrors. Go to your doctor.
Podiatrist, yeah.
Your podiatrist. Number 7, make sure your feet are not dry or cracking. That's one of the things we see in a lot of the diabetics. The first thing to go on them is their sweat reflex. So
making sure they're staying hydrated too.
Staying hydrated is important. Use moisturizers like vitamin E or olive oils. We also use Footlogics in our clinics, which we love. Number 8, don't use petroleum-based petroleum jelly, baby oil, or over-the-counter lotions because
Vaseline.
they don't absorb into the skin, into that epidermis. Don't smoke cigarettes. Nicotine can cause a closure of the vessels or a vasoconstriction, so it doesn't help you heal. Number 10, keep your feet away from heat. That's heating pads, electric blankets, hot water bottles. I can't tell you how many times I've had a patient that has had burned his feet from being too close to a fire or standing on pavement on blacktop. Mm-hmm. When you bathe, you should bathe in lukewarm, less than 92 degrees Fahrenheit. Check the bath and shower temps with your hands or elbows, not your feet, because people are losing sensation. And we'll talk about that in our next segment. Number 11, wear warm socks and proper size shoes when you're in the cold weather. Diabetics, number 12, should have their circulation tested at least once a year. We do a pseudomotor test that looks at the autonomic nervous system. One of the first signs to go is also autonomic neuropathy, where you lose the nerve to the artery. And if you don't have hair on the bottom of your legs, it could be one of the first signs of arterial damage. Number 13, diabetics should not remain in cold temperatures for more than 20 minutes or 30 minutes. Do not soak your feet in water for 3 to 4 minutes, more than 3 or 4 minutes. This causes maceration of the skin and breaks down more easily and doesn't heal well. When bathing and showering, get in and get out, right? Wash up, don't soak. Number 15, if your skin is dry, your cardiologist should avoid beta blockers because of hypertension. Perceptions that help moisten the feet. 16, avoid statin drugs like Lipitor. These are anti-angiogenics. 17, don't shave down calluses. This is one of the most common issues for irritation. And number 18, don't trim your own nails. If you can't bend down or see them, ask a friend or go to your podiatrist. And I think that's it. Welcome back, folks, to Free My Pain Now with Dr. Matt DiDuro. And today I have another special guest. She's a patient and friend, Miss Doris Adams. Welcome.
Hello, how you doing?
Good, good. Thank you for being on. And August 15th marks 1 year ago that I actually met you. And really, some people change your life. You were one of those people that there was something about you that I loved from the first time I met you. You just still had energy. To give the backstory on you, you had suffered from some cancer, and you had to go through chemotherapy. And after your third chemotherapy session, you really got weakness in your legs and your lower extremities, and you had difficulty walking on your own. Was that correct?
Yes, neuropathy.
You got chemo-induced neuropathy. And when I met you, I was doing a lecture down in Stockbridge, and I got to meet I think it was your great nephew, and he would be there, and he would be there to help you get up out of the chair. And it would take you about a minute to wake up your feet and actually be able to use your walker or get in your wheelchair. And we coined it the chemo dance. And you made our clinics famous, Miss Adams, because of when you coined that phrase. And I think a lot of people's hearts went out to you because of how tough it was for you to get around and how limited it was for your life at the time. Is that correct?
Yes, it was very limited on a lot of different stages.
So, could you shop on your own?
At the time, I was doing quite a few things. I was taking care of my mom, and I was working, so I had to shop on my own. Mm-hmm. It would take me a long time because I would have to lean on the basket a lot, or either take that mobile wheel.
Yeah, little scooters. Yep.
The scooter, right, to get around on. And
so
sometimes the CNAs, the clinical nurse assistants, would go shopping for me.
Mm-hmm. So what I noticed right away was I thought we have to document you from the minute I met you, because no one would ever believe if she was going to be able to heal. And so we did. We did a video documentation case study on every part of your care from the first time you came in, which was 2 days later on August 17th. We did light therapy, low-level light therapy. We did the low-intensity lithotripsy or shockwave therapy on you. And it was right after Miss Angela Key, one of our medical assistants, she did that treatment. You actually slid off the therapy table and were walking. And we videotaped every aspect of it, so they can go to freemypainnow.com. And your reaction was priceless. And it was pretty cool. You've seen it?
Yes.
Yeah. And so, but what I loved was the next couple weeks and how you continued to heal and how you texted me and how you really just regained your life. And you didn't let pain overtake it anymore. I remember you went to the movies 2 times that first weekend, right?
Yeah.
And then the cool thing was she went and got season tickets to the Atlanta Falcons, and you would actually walk and go to the games, right?
Yes, after the treatments and everything, yes.
You were able to move on your own, right, without assistance.
Yes, it was.
That's
It was
pretty cool.
amazing.
And you continue to heal, right? Healing is a process, and it takes time. And we love that you're still coming in, and we get to check you. And not only are you a patient, but you've been an inspiration to other patients, and our staff has fell in love with you just because of the energy you give off. So kudos to you for sticking to our game plan. What would you say to that person out there that's suffering from pain and maybe just a little downhearted? What would you say? What advice could you give them?
I would tell them if they're going through neuropathy and some other things, lymphedema, they're having a lot of mobility where they can't move, this would be the great thing for them. Also, the lights, I use the lights a lot. Those help a lot because I use those twice a day sometimes. And what that does is generate the blood and keep the neuropathy from being your feet from being so numb. So it's a blessing to have something like this. I would say it would be worth the money to put into it.
It was worth the investment. Yep, it was worth the investment. Well,
it's worth the investment. Yes, it is.
Well, Ms. Doris, thank you so much, and happy anniversary. You've really made a difference in so many people's lives. Thank you for sharing your story.
Sure, no problem. Thank you.
Okay, have a good day. So what Ms. Adams was talking about there was how she actually purchased the low-level light therapy, the near-infrared, the polychromatic lights, so that she could use on her own, right? With chemo-induced peripheral neuropathy, there's sometimes no cure for it. So we still utilize those boots. You're very familiar with those.
Mm-hmm. And it probably kept a lot of her symptoms at bay. It's keeping it going.
That's circulation.
For improvement, yeah.
Mm-hmm. And it pairs so well, right? We've actually patented the use of the low-intensity shockwave extracorporeal device with the polychromatic lights to treat chemo, diabetic, and peripheral neuropathy. And she's living proof. And I will put our results against any other clinic in the country. And that's just the way it is. It works so well.
I agree. I mean, I think that's wonderful. And yet again, Dr. DiDuro, another patient that you could recall the date that they came in, you followed her care and single-handedly, was right there with her every step. So
listen, no good deed goes unnoticed. And, if you treat these patients like they're your own family members, uncles, aunts, cousins, and you care about them in that way, you make the right decisions, and the results will follow. You have to have the correct tools, right? We talk about this soft shockwave helps give our clinic almost superhero healing powers, right? And I guess the last few minutes, I really want to go back to, the overview on Dr. Bernstein's book, The Diabetic Solutions. And it's a great book. I recommend every diabetic to read it. He is, I think, 84 years old. He was 11 years old when he was diagnosed with type 1 diabetes. He's the longest living type 1 diabetic in the world.
So you have to write a book when you're
he's amazing. He really started self blood glucose monitoring. He is the one that brought this to the forefront, and he's been a great help in treating our patients and even my wife, Miss Sherry. So, we're talking about foot care for diabetics today, and limb-threatening diabetic ulcers will affect 1 in every 6 patients in the U.S. There's over 500,000 amputations per year. Non-healing diabetic ulcers are the major reason for leg, toe, and foot amputations in this country. They call it the salami surgery. They go in there and they cut it off. They are usually preceded by some type of skin irritation or a sudden injury, even like a motor vehicle injury, where your foot gets slammed into the wheel well.
Or stubbing your toe.
Mm-hmm. Virtually all diabetics that have this condition for over 5 years are at risk and have lost some type of feeling and sensation to their feet and lower extremities. Prolonged increased blood glucose levels, which we talked about in the earlier segment, will injure the small sensory nerves in the feet, called sensory neuropathy. And that's when they can't feel things. 60% of your balance comes from your feet. Furthermore, the nerves that control the shape of the feet are injured and can cause deformities in the toes and feet called Charcot's foot or diabetic foot. The nerves that stimulate sweating and perspiration are also affected. We talked about that's one of the first things to go with diabetics is that sweat reflex. This can result in the classic, often dry, cracked skin that we see in diabetic feet. Dry skin is more easily damaged and slower to heal than normal moist skin. Long-term high blood glucose levels can cause damage to the arteries, to the legs, as well as the minor arteries and small capillaries that supply blood and oxygen to the skin of the feet and the tissue. In order to heal, the skin can require 50 times more blood flow than normal skin. So if this increase in blood supply is not available, the damaged skin will continue to worsen, which can become necrotic or even pre-gangrenous. And the infection can spread up the leg. So that's typically why they do either below the knee amputation or above. These types of infections may not respond well to antibiotics. Blood supply to a normal foot needs a 100 increase in blood supply to heal. So impaired blood flow and loss of sensation can be a major factor why these injuries spiral out of control rather quickly. Impaired blood flow can affect feet from getting proper circulation, and patients can have that sensation of cold feeling. And if you're getting that, then you need to contact our office. And this is what we do at ATL Pain Institute. 72% of our patients are diabetics. Mm-hmm. So we've had a history over the last 10, 11 years of working with them. In closing, Doc, what would you say to those diabetics out there that aren't monitoring their numbers? What do they need to do?
Well, definitely start monitoring your numbers, but also, try out different treatments. Come to ATL Pain and really see if you're a candidate. Do the Toronto testing. See, how this blood sugar has affected you over the years.
Excellent. Thanks again so much. Really appreciate having you.